Welcome to Startup Health Now, the podcast where we celebrate health's most innovative entrepreneurs and the health moonshots that they're working to achieve. I'm Logan Plaster, editor of Startup Health magazine. Today we're taking a break from our regular week-to-week schedule to bring you something special because, well, these are strange, interesting times, and there's just no business as usual right now. Here we are in the midst not only of a COVID-19 pandemic that seems to change by the hour, but also an historic period of isolation and quarantine. So we thought it would be great to dial up Unity Stoakes, Startup Health's co-founder and president, and just have a casual conversation about how COVID-19 is impacting health innovation at large and startup health more specifically. So Unity's so glad that we could find the time to make this work.
Great to be here, Logan. And so where are you today?
I was going to ask the same question.
Because
it feels like
I'm holed away in my daughter's room in Berkeley, California. We've been sheltering in place. Yesterday, they put in kind of mandatory shelter in place for 7 million people in the Bay Area.
Wow.
We're feeling pretty fortunate because we're together with our family. And, you know, we've got a little bit of a backyard, so we're able to get outside a little. And I know a lot of our friends back where we used to live in New York City are kind of holed up in small apartments and environments, which is very challenging. So our thoughts are going out to all our friends and family and health transformers everywhere.
Yeah, I'm across the country in Baltimore. And even though we haven't had many cases in Maryland yet, people in the city are taking it very seriously, sheltering in place. Restaurants and bars closed, stores closed, streets are pretty empty. You know, I'm recording this from my small office that I have. And we too are fortunate to have the family together and have a little postage stamp of a backyard that the kids can at least get some fresh air in. So fortunate that way. How are people in the San Francisco area handling the new level of lockdown? I heard just this morning about even increased rules about who can be outside.
I think it's going through waves everywhere. I mean, what we're seeing is people are taking the kind of everything very seriously. People are staying in. Schools are closed. Small groups are not even getting together, so people are kind of sticking to their family clusters, and we're all in this together. You know, that's I think one of the themes we can talk about today, which is we're experiencing the same thing with our community of health transformers. We're really all going through this together, no matter where we are in the world, Baltimore, Berkeley, or somewhere else in Europe or Asia. It's definitely a global moment, and I think that's one of the significant things we've been thinking a lot about, which is that we're all experiencing kind of the same thing at a global level, and I think that's very significant. Going to have long-term impact on innovation and really also create kind of a new opportunity for thinking about solving some of our big challenges moving forward.
Yeah. So we obviously work with around 325 companies right now, and many startups are already dispersed workforces, even working remote. And yet this is still a massive disruption. You know, how do you see the current situation impacting the companies that we work with on a day-to-day basis?
Well, obviously this is a moment of dynamic change for everyone. There's not only chaos and uncertainty and fear, pretty much across the board, but on a positive side, it really is a leap forward moment. I think this is an inflection point. It's really, I think, a moment where global health innovation leaps forward. A lot of us who've been focusing on health innovation for past 10 or 15 or 20 years have been really kind of watching the incremental movements forward, incremental progress, all sorts of roadblocks around big and small, whether it's regulatory hurdles or sales cycles or the various challenges that you experience. And what we're starting to see is, and what I believe we'll look back on and see, is that this really is that inflection point where you start to see the explosion of new innovation and invention that's been going on over the past 10 years. You see it in action. So we're seeing that swiftly with telehealth, with telemedicine, with at-home care solutions. All of these solutions that have really been around for the past decade, but are being swiftly starting to kind of make their way into the various ecosystems. And I think that is a big moment. I think it's a big opportunity. We're seeing the regulatory, some of the regulatory hurdles swiftly shift as well. Whether it's, most recently with the telemedicine kind of regulatory issues around doctors being able to practice state to state. That has been a big challenge for telehealth companies for the past 15 years. So it really is a moment where there's an explosion of new innovation, but there's a lot of innovation and invention that's been around for quite some time that is able to go straight to market. And we hope that that's going to have a big impact in the moment we're in now. I think there's other issues, though. Behavior change. You're seeing, everything from very tangible things like people finally learning to wash their hands, which is a big deal. But we're seeing behavior change around how we work. We've been operating as a row company, results-only work environment, or distributed company for 15 years now. And so I think we're going to see those organizations, those teams that are very adept at working this way, kind of manage the new post-pandemic era differently than we are now. And we're seeing a lot of our companies are also used to working that way.
Yeah, I couldn't agree more in terms of the optimism that can come along with this idea of catalyzing the future. Obviously, we work with companies from 25 different countries. We're a global portfolio, and the work that our companies do is global. And even if the United States bounces back quickly, even if Europe bounces back quickly, and everyone is in this together, this could still have far-reaching and long-lasting global impacts and potential slowdowns. So I'm wondering what kinds of things concern you in terms of just business operations.
Well, it's a major
for
challenge for every business out
risks
there, every team out there. I think whether you're a small business, a fast-growing business, or one of the world's largest companies, you are being impacted. And in particularly, if you're a startup, and maybe you have less runway, or you're in the middle of a fundraise, or you're out trying to sell your whatever solution that you had 3 or 4 weeks ago, the whole world's changed. And it really is a moment where your adaptability quotient springs into action. And I think that's something that entrepreneurs are it's baked into their DNA. Your ability to change, adapt, be resilient, your perspective changing or being open to change, staying focused on a longer term mission, but being flexible to adapt in real time to your current environment, being ready and willing to collaborate in new ways. These are all universal things that entrepreneurs should have baked into their DNA. And we're seeing this really, regardless of what country our entrepreneurs and health transformers are, we're seeing this kind of adaptability quotient really be very, very helpful. I think there's a lot of health innovation companies today that are going to have near-term challenges that could be very, impactful in a positive or negative way to their actual business. But we're also seeing a lot of our companies are springing into action. They either have solutions that are immediately and directly relevant to helping with COVID-19 or helping people manage their care in home, helping with telemedicine, helping with diagnostics. We have companies like our company Cyclica, who's actually helping speed up the process of finding or developing a vaccine or other treatments. So there's a whole wave of innovative health transformers that are already working on solutions or have solutions that can make an immediate impact today. And I think this is something that health transformers everywhere should really be thinking about, which is how is what you are doing both immediately relevant, but also relevant longer term in kind of a post-pandemic world that we all are going to be living in.
Yeah. It has been so encouraging. I mean, as you know, we reached out on Slack to all of our health transformers just a few short days ago, or it seemed like a lifetime ago, about what they were working on. And like Cyclica, not only are they working on their piece of the COVID-19, solution, but so many of them are offering their services for free during this time. Just finished talking to Troy Bannister from Particle Health, and they're offering up their API, which can allow frontline physicians to access a patient's whole medical history in a matter of minutes rather than weeks or months, which it used to take to access somebody's Epic records. And they're offering that right now for free for the duration of COVID-19. I asked Troy, what's that worth? And he said some of these contracts, measure in the millions. And again, we keep seeing entrepreneurs, stepping up and saying, my telemedicine service is free. My this nutrition, this cancer,
it's
AI
really
platform is free.
An important point, because I think one of the common
amazing to see.
Commonalities between health transformers everywhere is their dedication to the mission that they're on. Whether it's the health moonshot they're on, or the purpose for why they're doing what they're doing. And I think many or most of these health transformers are driven by a true passion for helping people and for doing good things that will make people healthier or happier in some way. And I think that is an important point. There's so much innovation in the world today, and I hope that one of the positives that comes from this moment that we're all living in is that more of that innovation shifts to positive, meaningful innovation. In the case of these health transformers, it's health innovation, things that can really help people live longer, healthier, happier lives.
This might seem like a shift in gears a little bit, but I know you've got 2 little kids at home. I'm wondering, as you navigate this through the business and in your community, I'm wondering, how do you talk to your children about this?
there's a blessing in us all being at home together. We're all getting to spend time together and being together as a family, and I look forward to seeing what this does in a positive way to the world as more and more people are getting that moment to spend time with their own families. In terms of the practical realities, my kids are 3 and 5. We try not to talk too much about it. We try to focus on all the many other positive things that we can think of, and keep the focus on that. On the other hand, we're using this as a moment to really focus on washing hands and doing things that we can do together here, that hopefully will have a long-term benefit for them as they grow older, just in their day-to-day lives. But it's a meaningful moment to have this time, and they're even learning how to do remote play dates and things like that using FaceTime and Zoom. They're doing some remote learning, and then we have kind of a homeschooling scenario set up. So it's been an adventure for for all of us.
Yeah. I'm very curious to see how this is a catalyst for teleeducation, because there's so many applications of that and telementoring in the health innovation space. When you think about global health, the ability for people to share knowledge more rapidly, to mentor and guide from halfway around the world. And if an event like this can can give a shot of adrenaline in the
absolutely,
arm of
in a very practical sense, we are inside the tornado.
We'll be in an amazing,
and
we'll be in a really
it's a
strong
moment
position
of recalibration. One of the things we coach all of our health transformers on is to constantly recalibrate and reflect on where you are, what's working, what's not working. And in a practical sense, it's an opportunity to ask, is what you're working on important to you, important to the world in a post-pandemic world? Are you focused on the long term, but also adapting on a day-by-day basis? Are you able to kind of set your daily losses aside and focus on what you can do today or tomorrow to create, to fix, to solve? And I think, hopefully, as I mentioned a minute ago, like this just ushers in a wave of these amazing innovators around the world, kind of focusing more on meaningful innovation, whether that's related to education or climate change or health. We really do need all the best and brightest minds and most passionate innovators around the world and entrepreneurs around the world focusing on meaningful innovation. And this is that opportunity to kind of in a big influx, hopefully, of this energy into creating positive innovation for the world.
Yeah, I love that idea of taking this time to really take stock. I'm glad you mentioned this idea of coaching a minute ago, because I know that that's a big piece of what Startup Health does, really getting to understand the mindset of the entrepreneur and walking them through in a long-term kind of relationship, various steps of the entrepreneurial journey. And I wonder, beyond just taking stock, thinking about the other mindsets that are necessary to really thrive as an entrepreneur, how would you coach a health transformer in our community, really or otherwise, who's really particularly struggling during this time, whether it's with anxiety about the future, whether their business will come back?
That's a really important question.
Whether they will thrive in a post-pandemic world.
One of it's one thing to focus on your business at a time like this, but you need to also. We all need to focus on our personal lives and our own health as well. So, one of the things we coach on is other things that don't just relate seemingly to your day-to-day business, right? So are you do you have healthy habits? Like, are you getting enough sleep? Are you taking time to re-energize? Are you taking time with your family so that you can think clearly as it relates to the challenges and opportunities before you? Um, so, really making sure that you're not just thinking about your business, but you're also thinking about yourself. You're thinking about your family. You're thinking about your community and neighbors, and you're doing what you can to protect your own health and your family's health. So I think that's one of the most important things that we all can be doing now. And that's really the only way to navigate such a dynamic, turbulent time and be able to do that over the long term. This could be and will likely be going on for quite some time. And we need to be kind of thinking about the long term, but also managing our lives on kind of a day-to-day basis. One other thing I would recommend for entrepreneurs everywhere is to make sure you're not alone. Make sure you're connecting with other entrepreneurs, other people going through the same thing you're doing. So if you can do that virtually, that's what we do at Startup Health. We have something called Startup Health Circles. These are virtual online forums. We have our online Slack community. We have Zoom workshops. We have opportunities where we can all kind of get together, help each other, and listen and learn from each other, and also share our own challenges. So I think one of the most important things we can all do is have a community to lean on, in particular during these most challenging times.
Yeah. Yeah. I love that you mentioned batteries included, which I know is one of the core mindsets that we coach health transformers on. And as you were saying that, it just occurred to me that in a time like this, the mindsets that surround your business just become so much more important to me. In a time when everything is taking a hit financially, it all comes down seemingly to
absolutely.
your core, to your the
Well,
ethos
we're
of your
all in
business,
this
the
together,
mindset of your
as we
business is
started the
actually what's going to
conversation
carry
with,
you through,
and
because everyone is going to
mindset
be
is so
taking the
important. In
same
fact,
sort of financial hit.
I think we're going to be publishing
So
another
what
podcast
opportunity to take stock?
immediately following this with Steve Krein, my business partner, the co-founder of Startup Health, and Dan Sullivan, who's Steve's personal coach. That's really all about this issue of mindset and how entrepreneurs and innovators can lean in and the things that they can do in these challenging times around mindset. Two of those are the concept of positive focus, right? And not just focusing on what you're losing, but also focusing on the positive things going on each day, or the positive elements of progress at the end of the day. And then a second thing is just this, as you mentioned, this concept of batteries included. You want to be around positive energy at times like this. You want to be kind of surrounded by networks and communities and your family and things that are bringing energy into solving this challenge, or managing your day to day. So that's really, really important. And if we can all be those batteries included people, then we're bringing that energy into the room to help those around us. So we'll post the link to Steve Krein's podcast and Dan Sullivan's podcast, so you can all listen to that. I think it hopefully will be very helpful.
Yeah. Oh, I'm glad you mentioned the positive focus piece. I think that's a nice point to end on, and a good reminder to our listeners that we're going to continue to tell the stories of the entrepreneurs that are putting out their work for free during COVID-19, that are creating new products, building the solutions to this problem, often at great expense to themselves, on our blog and through startuphealth.com. So Unity, thanks for the conversation. So glad to know that you are safe and with your family. To close us out, Startup Health invests in entrepreneurs committed to achieving health moonshots. Our growing global army of health transformers includes more than 325 companies from 25 countries. You can read more about the inspiring women and men in startup health by going to startuphealth.com and clicking on content. And if you want to apply to join the community, go to startuphealth.com/getting started. Thanks for joining us.